Hi, and welcome to Healthcare Information Technology Opportunities in a Non-Traditional Setting, Physician Offices. I am Yvonne Diaz, and I'm a student at Santa Fe College. There is a diverse amount of healthcare settings that would benefit from the skill set that a health information technologist brings. Most people think a traditional hospital would be the only setting, but that's not the case. With the push for electronic health records, as an industry standard, more and more non-traditional facility settings are developing job opportunities for the HIT professional. One great place to work is a medical office or a physician's office. So, what is a physician office visit and how can they benefit from an HIT professional on staff? When healthcare services are provided by a physician and his staff in an office, this is considered a physician office visit or a clinical visit. The main goal of a physician visit is to maximize the physician and patient relationship so they can be able to obtain sufficient information to diagnose and treat patients in a cost-effective way. And the knowledge that the HIT professional brings to the table can help with medical records and much more. They can help with appointment setting, with coding, with billing, medical records maintenance, and just running the office or making sure that everything runs smoothly and all the rules and regulations and laws are being followed. Basically, an HIT professional can make a big difference in your practice. A good example is Gainesville is of a physician office is the HCA Florida Gainesville Primary Care Office. It's located at 6900 Northwest 9th Boulevard in Gainesville, Florida, and it also has a satellite office in Tioga, Florida. This office is owned by a national healthcare organization which owns many hospitals and ancillary service facilities. And now they're getting into the primary care business. So at this facility, the physician is not an owner. He's an employee like the rest of the staff. In this office, there are 6 medical doctors, 1 DO doctor, doctor of osteopathy. There's 3 nurse practitioners that practice there also. This office provides family medicine. So what's family medicine? Family medicine is a division of primary health care that provides comprehensive care to individuals of all ages and focuses on the holistic approach of healthcare. It also focuses in diagnosis prevention, disease prevention, health promotion, and complementary services such as diabetes management, vaccinations, and women's health exams like pap smears. The medical review revenue cycle management is the only method to control costs and to make the practice profitable while providing appropriate quality of care. Remember that that's the main goal, the quality of care. Most people believe that the revenue cycle begins with reimbursement, but this is really like the ending of the cycle. It really begins when the patient calls into the office to obtain an appointment. Vital demographic information is provided and must be verified. When this initial information is free of errors, the reimbursement process and the revenue cycle process is more timelier and more efficient. So this is a very important step. In 2021, the No Surprise Act was enacted, which requires all providers including physician offices, to provide a good faith estimate for all self-pay patients in advance. And this would be the time to give it to them. A self-pay patient is a patient that pays out of pocket and doesn't have insurance. So before they even come in, it is a law now in Florida that they have to give a, an estimate. Um, so this is an important step. On the day of the appointment, all information is re-verified and services are rendered. The patient actually sees the physician and the service and the visit is completed. At that point, all financial responsibilities such as co-pays and deductibles are collected from the patient or they're billed to them. The documentation that the doctor provides is very important for coding and billing, and good data capture is the key to the next steps. This data is sent to a third-party payer. ICD-10 codes are used to bill the diagnosis, and CPT and HCPC codes are used for the procedure and supplies and pharmacy. And all of these codes are placed on a CMS 1500 form. This is what is used to bill the physician office visit. And lastly, once the third party pays the bill or denies it, a remittance notice is sent with the money um, to the provider with the information of what was paid and what was denied. And at that point, an HIT professional would review the information and send additional information and to resolve to get the maximum payment. So let's take a closer look at the billing and coding aspect of the physician office visit. How do they get paid? As earlier stated, the only form allowed to bill this statement to bill is on the CMS 1500 form or the 837P, which is the electronic version of that form. ICD-10 CM codes are used for diagnosis, and CPT and HCPC codes are used for procedure, supplies, and pharmacy. Physician billing is a three-part process, which begins by choosing the appropriate codes for the diagnosis, then choosing the appropriate codes for CP and HCPC for the procedure and supplies and pharmacy. And the last part is the CMS determination of the appropriate fee-based for resource-based revenue value scale, which we'll go over now. Okay. So what are the components? What are the components of the resource-based relative value scale, or RBRVS? They are called relative value units, or RVUs, and they are defined by CMS as the practice expense RVU, malpractice expense RVU, and work RVU. The practice expense is what it costs to run the office. This would include rent, administrative costs, and supplies. With the high cost of malpractice insurance, CMS has incorporated a malpractice expense to help with these costs. And the last RVU represents the value of the physician's work and knowledge, what we would pay him directly. And since there is a large disparity in what it costs of doing business in a rural versus urban area, CMS multiplies these RVUs with a geographical conversion factor. This helps alleviate higher rising practice costs in certain areas. Okay, so what are the financial challenges that a medical office can incur? I spoke to Jacqueline Hernandez, who's the director of a cardiology practice for Baptist Health of South Florida. And what she stated that after the pandemic, there were three main financial challenges for physician offices that she's occurred. One of the biggest is staffing. Without the appropriate staff to assist the physician, services cannot be rendered. Another issue is the time spent on prior authorization. Some procedures require prior authorizations before rendering service. Since these physicians are the first source of care for the patient, they become the gatekeeper of these services when secondary care is given, such as hospitalization or a specialty consult to a cardiologist or an endocrinologist. This work is time consuming and it is not reimbursed by the third party payers. Lastly, it's the CMS rates and more specifically the decrease in rates that we see occurring. Starting 2023, the physician rate of reimbursement was decreased 4.6%. And this is despite the higher costs for medical practices and the difficulty in staffing. So I asked her what are some of the creative solutions that you see in the industry. And what she said was that what she saw was some creative sharing of staff and workspace. And she sees that more in the future. Opening a medical office involves federal and state requirements that are detailed in both federal and state statutes. Public health is largely policed by the state, but there are certain issues that the U.S. Congress did address in the U.S. Constitution. One great example is the Federal Stark Law of 1992. It prohibits physicians' self-referrals and has both a monetary and imprisonment penalties. This law basically states that a physician cannot refer Medicare services to a company in which they or a family member may have a financial interest in. The office can be fined up to $1,500 per fraudulent claim, and they're required to pay back 3 times the amount of the claim and can be terminated from any federal healthcare programs in the future. And also imprisonment can occur. Another federal law that is very important to the medical office is the Anti-Kickback Law of 1986. This federal law makes it a felony to receive any type of remuneration for referring a patient to a consulting service or ancillary service. These include gifts, money, trips, or anything of monetary value. HIPAA was enacted in 1996, and it was in place to ensure that medical health information remains private and secure. Although there are not a lot of federal laws that apply to the physician office, all the laws have to be adhered to. Okay. Florida statutes details the requirements of opening and running a medical practice in the Florida statutes that start at 458.304 and it goes through 458.351. It specifies who can provide the services and the roles and responsibilities of the medical physician and the medical assistants and their staff. It even details reporting requirements to the state for adverse events that happen in a medical office. Medicare and Medicaid, or CMS, are the biggest payers of healthcare in the United States. The CMS developed a set of rules that must be followed. These rules are called Condition of Participation, or COPs, and Condition for Coverage, CFCs. These rules must be adhered to in order to become a participating provider to their programs. CMS uses an approved accrediting organizations that go through the approval